Welcome, dear viewers. You've tuned into Contentious, where we delve deep into the heart of the most debated discussions of our time, shedding light on the diverse perspectives that shape our world. We strive to provide you with well-researched, unbiased content, breaking down complex issues into digestible pieces. Today, we're embarking on a fascinating journey through the digital landscape, exploring the role of doctors in the age of social media. In a world where information is just a click away, the pandemic has brought to light the power and pitfalls of these platforms. Who can we trust? What role do our healthcare professionals play in this narrative? And what happens when misinformation spreads faster than the virus itself? Stay tuned as we unravel these questions and more, inviting you to join the conversation. Welcome to Contentious. Let's begin. Ever pondered the role of doctors in disseminating accurate information on social media? In our increasingly digital age, this question has never been more critical. In the whirlwind of the COVID-19 pandemic, social media platforms have become hotbeds of information and misinformation. As the world grapples with this unprecedented crisis, the role of physicians as trustworthy sources of information has come under the spotlight. A striking example comes from India, where the IT ministry requested social media companies to remove any content referring to an Indian variant of the coronavirus, arguing its lack of scientific basis and potential to spread miscommunication. Meanwhile, in China, thousands continue to message the late COVID-19 whistleblower Dr. Li Wenliang, expressing their gratitude and feelings. His Weibo microblog has become a place for anonymous expression, demonstrating the power of social media in shaping public discourse. But it's not all positive. Some physicians have been found spreading COVID-19 misinformation on social media platforms, with primary care doctors being the most likely culprits. This misinformation has had detrimental effects on vaccine decisions, with 72% of healthcare workers blaming disinformation for this. In some cases, spreading misinformation online can even be profitable. One group reportedly profited at least $15 million by marketing debunked treatments for COVID-19. Unfortunately, there are few professional or legal consequences for spreading misinformation on social media. With no federal laws regulating medical misinformation and only a fraction of cases being penalized by state medical boards. Some states have even passed laws protecting the right to spread COVID misinformation. In this complex landscape, the role of doctors in promoting accurate, science-based information is crucial. They are called upon not just to treat patients, but also to combat misinformation and guide the public towards reliable sources. In conclusion, doctors play a pivotal role in disseminating accurate information on social media. Their influence can be a force for good, promoting science-based facts and combating misinformation. However, the presence of physicians spreading misinformation highlights the need for stricter regulations and professional consequences. As we navigate the digital age, the role of doctors in shaping public discourse on social media is a topic that warrants further exploration. However, some argue that doctors should not be the sole arbiters of truth on social media. They point out that physicians, like anyone else, can be subject to bias, misinformation, or even manipulation. This underscores the importance of critical thinking and diligent fact-checking by everyone who consumes information online. Additionally, the responsibility also lies with social media platforms to regulate the spread of misinformation and to provide users with accurate and reliable sources of information. While doctors play a crucial role, it's also important for individuals to practice critical thinking and for social media platforms to take responsibility in their role as information disseminators. As we draw to a close, it's clear that the issue of misinformation, especially in the realm of health, is a complex one. It's not only the responsibility of our doctors, but also of us as individuals, and the social media platforms we use, to ensure that accurate information is disseminated. The fight against misinformation is a collective effort. Thank you for joining us on this journey through the contentious world of social media misinformation. We hope this video has sparked thought and encouraged a more critical approach to the information you consume online. If you found this video insightful, please give us a thumbs up, share it with your friends, and subscribe to our channel, Contentious, for more thought-provoking content. And remember, the conversation doesn't have to end here. Drop a comment below with your views on this topic. Your perspective enriches our collective understanding. Stay tuned for our next video, where we'll be diving into the contentious world of deepfakes and the challenges they present. Until then, stay curious and stay contentious.